So before we get started, I thought I would share just my personal inspiration for doing this. The truth is that not a week goes by without me waking up and really looking forward to seeing all of my clients and then driving home from the office and just feeling touched to my core about where the therapy was able to take us. And that just wouldn't be possible if it wasn't for the life's work of Dr. Habib Davanloo. I just have this profound set of gratitude. If you could mute yourselves, by the way, so we don't hear dogs and sirens and whatever else might be going on. Okay. So my personal inspiration for doing this is that this has affected my life tremendously. I look forward to seeing my clients every day. I drive home from the office almost every day, just touched to my core about what's been able to happen in the therapy. And that's thanks to Dr. Davanloo. It would not be without him that would happen. At the same time, I think it's important to be clear-eyed about the fact that he wasn't perfect. He was a work in progress like all of us. And so my bias is that it's important to not lionize the guy and idealize him over here, but also not to trash him for his imperfections. So that's the needle to thread, in my opinion. And housekeeping-wise, it's a large group. So I want to start off with introducing a little bit of structure. So why don't we start off with a hand-raising system to avoid chaos? And if we get a good flow going, we'll just scrap that and we'll just have conversation without the need to raise your hand. But why don't we start with that as a system so that we don't have chaos on our hands? All right, and if I haven't said hi to you personally, I'm sorry. I'm really glad that you're all here. This is so exciting for me. And any questions about the structure before we get going? Okay. Well, then, without further ado, let's get into it. Who wants to begin to share their thoughts about the reading, either an overall impression or something specific about one of the articles? And you can either raise your hand like this, or I think Zoom has a function of raising like an emoji or something.
It's under reactions.
Okay.
So if you go to reactions and you click on the little heart sign there, there's a little button there that says raise hand.
Thank you.
Apologies.
For that tech support. Thank you. I see Justin Witt. Go ahead, Justin.
Hey, thanks.
Sure.
Generally, I think I've recently come back to Davanloo. I was talking to you about it. I think I had sort of avoided reading his transcripts for a while, but practicing ISTDP for a while, coming back to him, and seeing a lot of nuance that I was unaware of on my first passes with him, especially how he goes into the transference, often in a way that's sort of just to sort of dip in and then come back out. I think you described it almost at times just to sort of like tighten a screw if it needs to be, just to sort of move the process along. Whereas before, I had always had this sense of like going into the tea was this sort of like, here we go, I'm gearing up for this huge thing that it doesn't always need to be. It can just, like, something's gunking up the works. Is it us? Like, what's going on? Let's check it out. Okay. So it's very helpful coming back to those transcripts.
I think that's such an important takeaway, is that in the readings, we didn't see him like go for these huge unlockings. We didn't even see him do a portraiting, actually. And yet it seemed to be really productive. So I think that the readings can be helpful in getting us away from the idea that it has to look a certain way. And go right ahead.
Do you want us to start with the angry woman, or do you want and then move to the German architect, or are we doing everything together?
At will.
Oh, okay. Well, then let me say two things. One, in terms of the German architect, let me just read this because I'll mess it up if I try to speak it. When I first read it through it the first time, it seemed that Davanloo was magical. I couldn't figure out how did he figure this out to go where and where. So I went back and I read it again. And lo and behold, he was simply following his metapsychological process. But he, after working 20 to 30 years, every night, day and night, watching videos, he can tell just almost by a glimpse or a sound what is coming next, and he's ready to intervene so quickly. And he sticks so carefully to the central dynamic sequence that it feels like how the pub thing came up and so on. It's just I just that's wanted to just say that. And then the other thing I wanted to say is that in the angry childlike woman, that he puts an emphasis. He talks about countertransference, and he talks about it on page 265. And he says it sounds like the countertransference held an important position in supervision. What's happened to it? If Kernberg does a magnificent review of the literature on countertransference in 1975. And he talks about the problem with identification with the patient and how that can pull us off. And given that Davanloo was so he was so where did I put the word? Had such an incredibly strong observing ego, and but it seems like he's devoid of emotion, like he goes top down rather than bottom up. And I am curious about those things.
Yeah, thank you. And although, he did acknowledge, right, in the discussion with his colleagues at the end of the Angry Woman transcript, that he felt very positive, very warm towards the patient. So
yes, he did.
So he does have that. How about you, Tanya? I can see your hand is raised. Have at it, Tanya.
I'm not sure if I missed something. I wasn't able to finish the Childlike article, but I'm curious about, I don't know if this is relevant, but the reason why we started with these two articles. And I noticed this contrast in, reading the German architect, him being very clear and adamant, let's not get to history. And with the childlike woman, very much going into history as soon as she mentions, the father and the 13-year-old. And so I don't know, maybe I'm looking for a rule to follow.
But there is one. The good news is that there is one.
Okay, please.
Yeah, well, the road is, as far as I understood it, and if you all have different opinions, that's great. But with the German architect, the guy was too resistant. There was too much resistance right out of the gate, so that any attempt at getting that history through the dynamic inquiry, it was useless because there was just too much resistance getting in the way. Whereas with the angry childlike woman, even though there was vagueness and some other defenses on board, she was highly, highly collaborative. So it was sufficiently productive. He was able to milk the inquiry much, much more, whereas with the German architect, it wasn't even possible. It was like trying to squeeze water out of a rock. Yair.
Thank you.
One comment about the last point is that I also noticed between those two articles that helped me understand what we mean by resistance and the therapeutic alliance, where the therapeutic alliance means that we see that the patient has a curious position about the inner reflection. And with the angry childlike woman, when Davanloo intervenes, she was curious and she brought up like new information, and she was willing to look inside, meet herself, try to understand herself. Where resistance is a force that said, no, I want to avoid meeting myself, avoid knowing myself. So I think that this is, and while reading the German architect, I was struck by, I was reading it for the second time, and I noticed the differences, how what gets me and what I know this like this other time around when I when I have more like more mileage of work, is that what I noticed during reading it, and there wasn't like a major like unlocking of rage and the like great portrayals, and I saw how Davanloo, I mean how he writes. In a way, he feels very like positive and really like enthusiast with the with little like little steps on the way, little steps of progress.
Yes.
Whenever you see a progress, he writes down there. There's the I managed to get a major communication.
Yes.
And what way I managed to get the patient to be curious about himself and collaborate with me.
Yes.
And
Yes.
there's those little things that while training, usually I forget to tell it to myself. I end the session. I said, did I get an unlocking or didn't I get an unlocking?
Right.
But during the way the session, I forget to tap on my back when, hey, I got a collaboration. Wow, I got a major communication. That's good progress. And
Amen. Amen.
while I'm writing, I'm seeing that Davanloo wasn't so harsh with himself.
Right. Yeah.
And he managed to be good with himself.
Yeah.
Also.
He's so hyper focused on signs that the UTA is active. He pays such close attention to the resistance, communication, or alliance collaboration continuum, right? The antithesis of the resistance is the collaboration and the alliance. And he's always on the lookout for where are we on that continuum? Where is the patient? And he can hear those glimmers from the unconscious therapeutic alliance. He pays so much attention to it, and he capitalizes on the small wins. Even the unlocking of the German architect, where, I mean, he raises his voice at Davanloo.
Yeah.
And Davanloo determines that that is an unlocking of the unconscious. He doesn't go for more. He doesn't push for a portrait. Instead, he recognizes that there's an unlocking there, and then he deals with the residual resistance as he goes. But it's very different from, I think, what a lot of us think of when we think about ISTDP. So I'm just thrilled that we're all looking at this so that we can recalibrate our expectations and get a fuller picture for how this work can actually go. So thank you so much for that, Yair. That was a beautiful sharing. Brittany and then Bert. Yeah, you're muted. Yeah.
So one thing that I also thought was interesting, and maybe this sort of ties in a bit, or it's a little bit like Yair's comment, is they move the angry childlike woman to a female therapist, and there was a lot of resistance or, negative transference towards her because of her relationship with her mother and yada yada. And, the woman ends up being like, I kind of did this all myself and didn't want to show any gratitude. And one of the comments is that maybe this is actually a good outcome, right? That somebody who has been so passive, it's maybe not ideal or whatever, but like, so sometimes even things that maybe look like mistakes or missed opportunities might still be positive things because we don't control other people, you don't control the client. And really the important thing is that they're walking away healthier and better off. The other thing I thought was interesting and don't need to go into a lot of detail about, but was, seeing all those other therapists who were like, this woman can't do this therapy. And I was like, I can't imagine what their standards were because she's very forthcoming actually, and seems relatively direct and all this other stuff about her serious problems. So it's just interesting that I'm glad we're not at that sort of incredibly demanding level anymore.
Yeah, totally agree with that. Thanks for sharing. Totally. Let's see. Let's do Bert. I think it's your turn. Go right ahead, Bert.
Sure. Just again reminded during the readings of how important it is to follow the client, let the client, in a sense, lead you where they need to go. That you don't push some sort of an agenda or something like that. Just responding moment by moment to the client and letting it build up accordingly. And again, we see the difference between those two clients, each of them approached in a different way, but each time meeting them where they are and seeing exactly what this moment is revealing in the triangle. Either relationally or in the conflict triangle. But just giving, just sort of feeding a little bit of information about those triangles to the client as they sort of move through what they're saying. And then I also noticed that really, in a sense, that good old basic counseling skill or interview skill where you give those summaries, where he, every now and again, he brings it all together. You know, we've explored a bit, he brings it all together. They explore a bit more, he brings it all together.
So important to do that. I'm glad you noticed that. The first bit that you said made me think about, at one point with the angry childlike woman, she says something to the effect of, well, it's difficult. And Davanloo says, well, why don't we make it easier by looking at some specific examples? I thought that was a good moment.
Yeah.
So someone wrote something here. So let me just look at this as you. Boo, can you speak up? I think I get the gist of it, but can you say something about this question?
Sorry, Johannes, I'm just trying to navigate the buttons here. So like when you mentioned he raised his voice, clearly there was some affect that was kind of rising in there. Were there other indicators that you noticed where he kind of pierced the unconscious temporarily, but didn't feel that need to rush in and kind of force the portrayal at all? Were there other things that you'd seen? I kind of noticed a couple of things along the way there, and I was just going back over the article and see if there's anything that you were noticing besides him raising his voice.
I'd have to take a closer look at it, but I can do that right now. We can pull it up. And so I would invite everybody to reflect on that. I think that's a great question, Boo. So if any of you remember the indicators, please feel free to just speak up. But in terms of those indicators, I mean, the main indicator was that he raised his voice, right?
And then I noticed after that, there was, I think, some sections where he was starting to talk about, some historical stuff, some painful memories where his father was intoxicated and some other things. I think he started talking about there, if I remember correctly.
Right. But that was on the heels. That was subsequently.
Yeah.
But you're asking about indicators that the unconscious actually unlocked. So first of all, who remembers the page number? Because I happen to not remember the page number. Was it on? Here, I'll just search for. Is it on page 133? Is that it? No, that's not it at all.
On 124.
Thank you. 124. So let's have a good think about this. So 124. So there's the focus on belligerence.
Yeah, he starts becoming contemptuous and starts saying, he says, God damn it, and then starts to raise his voice a little bit there.
That's right. That's right. Yeah, so in the middle there, no, when you said, God damn it, how you felt inside, Davanloo is questioning. Patient, fine. Therapist, now you said fine. Patient, oh yeah, that's the wrong word. So he seems to be getting lippy and sarcastic here, right? Did you feel irritated at any time, if you be honest with yourself? When you said, God damn it, did you feel irritated at the moment? Patient, yeah, because, therapist, so you felt irritated. Patient, no, I was just trying to make a point, and, no, you see, again, you water down the whole thing, and a smile, yes. Now there's a further rise in the pitch of the patient's voice. Patient, oh, I can damn well tell you when I'm irritated, but that was nothing to be irritated about. Davanloo, oh, you mean you didn't get irritated? Patient, no, I'm getting irritated now. Therapist, you're getting irritated now. You mean you're getting? You are now, you mean. Patient, I could be easily irritated. Therapist, okay, are you irritated or aren't you? Patient, I'm getting there. Therapist, you're getting there. Now, what is the way you experience this irritation right now? You took a deep sigh. Thinking again. So how did you experience this irritation? Did you feel that you wanted to lash out? So he's sort of leading the witness a little bit here. Patient, no, I raised my voice instead. Therapist, but did you feel that you wanted to lash out? No. What are you like when you get angry? I raise my voice. So that's all we have. Like, that's the empiricism right there. And so there aren't really indicators other than, I mean, there was a deep sigh, right? There's the comment about the deep sigh, but we don't.
When he started asking for that example, Johannes, and then I thought he was going to go into a portrait there, but then you see where he keeps kind of working the tactical defenses a little bit, just letting him kind of bring up the affect a little bit, rather than just diving into the portrait.
Well, that's right. There is no portrait at all, other than he
Yeah.
introduces the idea that did you want to lash out? And so part of the reason why I think that's so important is for us to realize that we could actually be looking at an unlocked unconscious without realizing it, because we have this narrow view of what it has to look like. That's what I find exciting about this. Thank you for that, Boo. Thank you for that. Steve.
Okay, so I just wanted to follow up on what Bo pointed out. Thank you very much, Bo, for mentioning the piece about where he raised his voice, because when I was reading about the German architect, what I kind of thought was interesting, and this is part of the thing that I've always kind of suspected and or wondered about ISTDP, is it tends to be, there is a myth, I guess, or there is this belief somehow that when people do ISTDP, that it tends to be iatrogenic, it tends to provoke the patient. Yes, I am fully in agreement with everything that Davanloo said here, both in this article, but also in the Childlike Angry Woman. But I think, particular with the German architect, he is saying, are you feeling angry? Are you feeling irritated right now? And he says, well, no, I'm not, but yes, I am. And so, yes, I can see in some ways that the patient himself, the German architect, is ambivalent. He's not really being honest. They're both of the patients, both the German architect and the Childlike Woman, they're both really, really vague. Like, what are you here for? Well, I don't know. You're the boss. You're the doctor. You should know what it is that's inside my head, which is a problem. But when I have said, did you notice that when you talk about this particular situation here in the past about this other person, this is in my own experience, that if I start to introduce something that provokes some degree of feeling in it, there's a real chance, there's a real threat of a rupture. And I thought, this guy is going for a rupture with the guy. I don't know what he's doing. I don't know why he's provoking him so much, why he doesn't take a step back. It's like, are you feeling angry at me right now when I'm asking you these questions? And I'm just wondering, I mean, I don't know how it happened. There must be some dialogue that's left out of this particular excerpt in some ways. But, I would say you're going for a big fat rupture here. And I don't know how he gets around it.
Yeah.
I mean, I know it's provocative, and I know that he's pointing out, are you realizing, guy, that you're raising your voice at me? If you're raising your voice at me, do you think you might be angry, either at me or at somebody in the past that you might be angry at? And the guy's like, no. And then if he's like, do you see how you're in denial right now? It's like, if you pick away at the person, of course, is going to become angry at you because of what you're doing in this moment, which may or may not have anything to do with there being a transference in this moment. Could be, indeed. But you're also at risk of having a rupture. And obviously this German architect just had at least a rupture with his father, if not anybody else.
No,
so I'm just wondering.
Yeah, go.
So I'm just wondering if you can, sort of put this out there and say, like, usually what I do is I try to say, okay, so you're angry at me at this moment. It sounds like you're feeling angry at me right now at this moment because you're raising your voice. Right. Can we maybe look at that?
Yeah. And that may have been a very effective intervention. Steve, I appreciate that you're raising the issue of iatrogenic responses. And are we looking at a situation where we're getting affect, but it's because the therapist is being provocative? So why don't we raise that to the group? I would love to hear opinions about that from the group.
Please.
Yeah, we have, let's see, I see a different hands. Dr. Kanwal, am I saying that right? Dr. Kanwal?
Yeah, hi. Oh, thank you for doing this. So just the last question, I think depending on the resistance that the patient is presenting with in the room, and the layered, like it's a character pathology. So for a character pathology, he is going in with like almost like 30 to 40 pressure built on top of each other. And without that, the patient would not be able to he would continue to be in therapy for like the next 5 years as the other patient was probably. So that's one thing is that, and he's only focusing on what the patient is presenting with, the way the patient is, and making him see his own defense and then going to go against that. So that's one part. And then the other part, which was the previous question, was about what tells us that I mean, there's no need for a portrait because the unconscious, when it's been penetrated, the patient is now aware. Because if we look at the curve, when we look at the curve of the resistance and the complex transference feeling, so the complex transference feelings go above the resistance, and which is where what is called as breakthrough or so that's why I think just wanted to make a couple of points about.
Oh, thank you for sharing that. I think that is very sensible. Harrison, how about you? What are your thoughts about this?
Sorry, you know, I really
Yeah, hang on.
Sorry.
Bert, just
Unmuted.
yeah, yeah.
Yeah.
Oh, yeah. Just a sec, Bert. Harrison and then Bert.
Appreciate it. I was just gonna say, I think it pertains to what we're talking about right now. One of my favorite quotes by Davanloo is in German Architect about how if the therapist is directing the patient towards his, painful buried feelings out of genuine compassion and concern, then you don't have to worry so much about kind of everything going wrong if you make that your North Star. And I think that's part of what might be happening in the background. We just don't get in words of transcripts where, I'm just imagining that Davanloo is picking up on something. He's not just iatrogically trying to get the guy angry for the sake of affect being in the room, but he's sensing something enough that, like, I know it's there. Let me try to go for it. Kind of using his countertransference to guide him to know when it's like right for the picking, so to speak. Whereas other times you're just going to get into a true mess because you're just being nitpicky. That's my take on it.
I think that's true. That's a beautiful comment. Yeah, that's what it all comes down to. That's the million-dollar question, right? Are the feelings that are getting mobilized in the patient a result of just provocation, or are they a result of the therapist attunement, and that they can sense that the therapist is laser focused on areas that are unresolved and painful? So that's spot on. Thank you for that, Harrison. Thank you. Bert, I know you had your hand up, but can we let Stella go first since she hasn't said anything? Is that all right, Bert? Okay, Stella.
Well, I just want to go back to what was it, Steve, who was saying that it feels like a provocation rather than following the unconscious. It definitely felt like this to me, that it's an effect in the room because of the interaction with the therapist. And at the same time, it's clear from the interaction when he was saying, I'm learning from you, that he immediately puts him in this father position. So it might make sense why Davanloo was already sensing the anger. But still, it feels like a provocation.
From your point of view, you're agreeing
Yes.
with Steve that it felt like a provocation. Is that right? Okay, thanks, Stella. Thank you. Yeah, yeah.
And I want to ask, what happened to goal first? They go through many steps of defense work, but there is no goal.
Well, Stella, the way I remember it is that the way it plays out is that Davanloo tries to get to the goals, but it's not possible because he's too distant.
Resistant.
Yeah, too resistant. And so that then becomes the focus. Basically, hey, I can't even understand what's important to you to get out of this because you're vague. So basically, yeah, it'd be great to get the goals first, but this is a case where that wasn't possible, and we saw how Davanloo dealt with that, basically. Is that how you saw it too, Stella, or did you see it differently?
Well, I saw that there were many opportunities to go back to, okay, so we don't have the goal, when there was more of UTA coming, that he, instead of nitpicking, maybe you said this, go back into, okay, so now we see this, so can we go back, like, what's the goal here between us?
That may have been effective. Yeah, that's a good point. Thanks for sharing that.
Okay,
I didn't think. Yeah, thank you. Bert and then Randy.
Yeah, just a comment on the last thing that was said. It's been my limited experience that, if the person is wound up and bound up in defenses and anxiety, and essentially living his life from that position, and you ask him, what's the goal for therapy? He's going to give some sort of anxiety-resistant defensive goal, which is in any case going to be undone in the next 2-3 hours. Because his defenses and anxiety is going to change. Anyway, but I wanted to say something about what Steve was saying, because I concur with parts of what he said there, is that, I actually even read it here in this writing, and I was trying to find the exact word that he used, but essentially saying, don't badger the client, And then what he seemed to go, as I was going through the transcript, I thought, but isn't that badgering the client? You're just doing it in a slightly different way, but you still seem to be badgering the client, and that's a problem or an issue or a concern that I've always had with ISTDP from the beginning. I'm starting to change that view slightly, but it's what Steve was saying, that of course if I'm going to say these things to you, you're going to get angry. You understand? It's like you weren't angry a minute ago.
Right.
Okay, so then I make you angry and then say to you, you see how angry you are about your life? I just made you angry.
Oh, I get it. You're sympathetic with Steve's views. I get it. Yeah, I get it. Thank you, Bert. Thank you. So let's get to Randy and then Sandra.
I just wanted to jump in just in this process of, I'm in core training, right? So I'm kind of still learning what it is to, even be involved in this process. But what I'm noting, what seems to be a little different with what I'm reading, and a little, a couple of steps further in, I think it's a little bit to what Harrison was saying, but not exactly. Like, it seems to me that Davanloo is really less focused on any interpersonal. And I think it has to do with really what he's bringing from his life experience and just ability to hold conflict and anger on his side. And then he's like kind of going over and like really trying to experience what's happening internally, because he wants the client. It seems like there's this really understanding that the client needs to understand their relationship with belligerence before I start to bring it into how it's playing here. And there's just like a deeper, I don't know if I'm even, onto anything, but it feels like there's like a deeper scaffolding I'm like feeling into. And again, we only have our paper and our imaginations, right? But that's just standing out more. And that's ultimately like a therapist, internal rep. Like at some point, it's not a skill. Like it's just like, how do you deepen your ability to hold conflict? Anyway, that's a driving force, but thank you.
Oh, thank you. I really enjoy that comment. I'm going to think about that, Randy. That gives me something to think about. Thank you. Sandra. Where are you, Sandra? I saw you and now I don't see you. Where are you, Sandra? If you're there, you're muted. Okay, so maybe she was here. I swear to God, she was here. I saw her hand. Sandra, if you're there, you have an opportunity right now, but I don't see you anymore. So just come on back, Sandra, whenever you feel like it. Let's see. Is that you, Nick?
Yes. So I was just reflecting on what Steve and Bert kind of seeing this thoughts about rupturing, and I reflected how much differently I read this transcript from when I first started training in ISTDP. And now I can kind of see, I guess, having been in situations where I'm able to have a lot of pressure and a lot of pointing out things, and he even talks about the smile multiple times. He just points it out, and you smile and you smile, and there's this like feeling in the room of a mutual, you're doing a mutual thing together, compared to what it can read like when you kind of first read these things. At least that was my experience. You first read it and it sounds so like harsh and quick and this kind of thing. And then now I read it and I don't know obviously how Davanloo sounded, but in the room, but I kind of picture it just this calm, matter of fact manner of speaking. And when I read through each one, "Oh, but you said belligerent. Oh, but you're smiling now," and just this really calm way of doing it. And it's actually the client that's the only one getting more escalated. I find that quite a useful contrast to how I first read it and feeling like, oh, this ISTDP is so intense or whatnot. But one other quick one was just the difference between the German architect and the angry childlike woman was how he didn't do that at all in the angry childlike woman because she was so collaborative even if defenses were on board, and kind of seeing her talking about, oh, I have this problem and I've been having it my whole life. Like, this is her actually talking about the problem versus the first statement the German architect makes is, I don't know what my problem is. And I am curious for you, Johannes, or the group, what, if anything, changed in his style between the angry childlike woman to the German architect time period, because I find it hard to compare when there's a collaborative focus in the angry childlike woman and he's kind of doing this initial assessment versus
that's right,
the German architect.
Yeah. Yeah, probably, Nick, probably, but it's so hard to tell because of the different presentation. You know, she's so much more collaborative, so it's just really hard to tell. Probably there was some change, but I just don't know. For what it's worth to you, the way you were channeling Davanloo, that's how I remember him, how he talked. That was his attitude. So you got him. You channeled him. Nice going. So yeah, I just want to make sure that Sandra, you're still not here? I'm not sure what happened. Okay.
I'm here.
Oh, you are? Okay.
Yeah, but I don't know where you guys were in the flow, but while you were kind of talking about, was he provoking the patient or not? I was going back and I was reading through the transcript in that spot, and to me, he's not, and has actually a really strong alliance, because right before that happens, the patient spontaneously brings in my father, and then they're having a conversation about he defies his father. And then Davanloo has already established, like, yeah, you're vague, basically. And then he starts going for it, talking about limbo. And then I see he's like kind of applying the pressure on limbo as in regards to the patient's anger, which he sees when the patient says, God damn it, which, like, we know is linked to a different area of the brain when you use an expletive than when you're using like regular speech. So it tells you like something is different is happening. And he knows that he's going for the spot that the patient doesn't like because, well, now patient is talking about father, like he's becoming kind of more defiant. And then he swears and it's like, oh, like, I got you. But he knows that the patient is with him because he's spontaneously talking about this stuff. So I saw it as like, and I also really like we don't know his tone when he's talking to the patient. So I think if you imagine that they're adversarial, then you could put that tone in it and be like, oh my God, they're having an argument. But if you imagine that it's really calm, like he could say all of it really calmly, and he doesn't like fight with him about it. He just says, like, so you're saying this. And then the patient was like, no, I'm not saying that. And he's like, so are you saying it or are you not saying it? Because you just said it, but now you're saying that you didn't say it. So I could imagine him doing it completely calmly and like with, like, he knows he has this strong connection with the patient already. So when you have that, then you know that even if they're like appearing to kind of argue on the outside, you know that you have that deeper connection with them, and so you can push it more because you're already on the same side. So I thought his timing was like, he saw it and he's like, oh, perfect, let's go.
Yeah, you see attunement and alliance. Point well made, Sandra. Point really well made. Thank you. I think, Robert, you've had your hand up, and then I think it's Yair. Forgive me if I get the order wrong.
Yeah, I had my hand up, but I'm really going to piggyback on the last comment, and also Nicholas, that when you read Davanloo, you can read the aggressive tone, or you can read a calm, inquiring, I think, concerned attunement. You said, and it's a totally different take on the whole thing. So, I just agree with the others. Thank you.
Cool. Thanks, Robert. Thanks for chiming in. I think it's Yair, and then we'll do Jesse.
Well, I would say that one of my the quotes that I really liked in the German Architect, the introductory, which now I read, and it's like seems like every sentence is so rich and it's so important to understand in depth. But there was one sentence that says about the pressure that the therapist does pressure on page 110, and he writes, all these questions are seemingly innocent and straightforward, but in fact they convey a powerful hidden message, namely that the therapist wishes to understand any given situation in depth, wishes to know exactly what the patient experiences, and will not be put off by evasions and half-truths. And where I read it this time, the emphasis for me was on the therapist wishes to understand. And I think it can be, you can say, well, I need to understand in order to do therapy, but it's all different when you're genuinely wish to understand the person in front of you. And I when I read them, I think that he has this therapeutic stance that even as a person when he's doing therapy, and also it's different for me when I'm doing therapy, and also not just as a therapist, but as a person really wishes to understand, it conveys it's conveyed differently, and the patient can feel it, can sense that he's sitting with someone who really wants to understand him. And I'll add to it that I think that what adds to it is the sense that you are you see the patient's potential. You're on the patient's side. You're when you're asking and when you're pointing out defenses. It's different if you point out defenses as, "Hey, can't you? I see that you're not doing good enough," and it's different. But I see something you're doing when actually you can do. I see you're so much more capable. You're and you can do. You can you can get to the truth. You're not. There's no reason to be afraid of the truth. So it's really
yes, totally agree.
a really different stance.
Absolutely, and that is very much in line with what Harrison was saying before. So, two of you are really lined up there. Thank you, Yair. Jesse, and then Brittany.
Yeah, thank you. Yeah, I went back, like this has all been really interesting. I went back to really look at how both sessions started. What sort of stuck out for me was how, from the outset, once vagueness came up, there was this like accumulation of like data points around this kind of underlying self-defeating mechanism that was coming up in both, but in different ways. And I really liked how it was really collaborative with the first one, where there was good ability to be able to self-observe and notice this wall that was coming up in terms of this passivity, as well as being out of touch with herself, which was a presenting complaint, and really operationalizing for this person how they come to be out of touch with themselves in this outcome, and then getting more specific, within that. So it's like this working together, which was much more difficult to do in the second case, because with the German architect, the self-observing capacity was much more limited. And I really liked how, with that, even with the German architect, he was aware that he had a problem with feelings. And so then from the change in the interventions, it was still kind of going for this same self-defeating mechanism. But at the same time, over the course of the session, with more and more resistance, accumulating more and more of these data points for the person to then see. And it seems like, then being able to get to that point, to really, show the patient, is this what you want to do, or do you want to keep self-defeating? In that way was where that difference was, I guess, around the badgering that we were sort of talking about, just having these multiple data points to really then put the conflict back in the patient. And I think that's what I really liked around the takeaways from that.
Yeah. Point really well made, Jesse. Really well made. I agree with that. Well put. Well put. Thank you. Thank you. Brittany, how about you?
Just briefly, because a lot of people have said a lot of things on this, and like I'm very sympathetic to whoever brought up this original point. I'm not seeing them. How do we keep from actually badgering people? When do we know that certain pressure is appropriate? And he actually, Davanloo shows us, right? They're already he says, right, that we already have the first emergence of the unconscious therapeutic alliance, and if you trace it back, he's built to this point, right? So it's not just, kind of at a random moment or just attunement per se. And I know how hard this is for me to follow, but he's following steps before he introduces certain things or goes to certain topics. And so that would be kind of my way of knowing when can you do this, under what circumstances is it going to be helpful rather than cause a rupture, which of course we don't want to do.
Yeah, thanks, Brittany. Point well made. I think it's Kanwal. I think you're up again.
So a couple of points. One is about tactical defenses and character defenses. So in the first patient, in the lady, there is more of tactical defense, and she's able to see it and give it up. The other gentleman, he has character defenses, and if those are they are allowed to persist, then again this patient will be. And the other thing is about, we know that the possibility of the patient returning is going to be much more, and the trajectory of the treatment is also going to be very different when the first session, which most of these are where a breakthrough happens. So that is also part of Dr. Davanloo's methodology. And the third thing, as I think few people have said already, this whole thing about provocative, like I would like to ask, and I ask myself, like, if I had a patient like this, what else would I do? So if we are calling this provocation, and if the patient is coming in with and built up these different, then what would I do? How would I approach it? Right? So it's very important to see it. And then the way he presented actually in the sessions. We know that only on paper, we can only see maybe 5 to 10%, like verbally, how much information, how much do we get? Actually, it's the presence, his presence, and the collaboration between him and the patient. And he was finely attuned to each little, like he used to say, each little like whisper that comes out. So I think a few things that came to my mind.
Yeah, thanks. Yeah, very good points. Very good. Robert, I think you're up.
Back to someone, I can't remember, maybe it was you, Jesse, or maybe it was you, Yair, and mentioned about page 110 when Davanloo writes about wanting to understand the patient. I think at depth, when we say to our client, hey, look, I really want to see you at your depth, we're going to generate a lot of feelings and anxiety right there, and we're going to see all the responses to keep you out. And that's the nub of what we're doing. We're trying to see the person. We're not only doing it for ourselves, but we're saying to them, I want to know you. And that's very anxiety provoking for all of us, probably.
Love that. Love that. Thank you so much, Robert. Beautiful. Let's see. Tyler.
Yeah, I just wanted to make a quick comment. Robert, I thought that was really helpful to hear. It's like we're communicating constantly that we want to know the client, but then there's this quote that he has that I always love, that we're also communicating something like we won't be put off by half-truths or evasions. Something about that kind of stuck out. I think there's something really powerful communicating to the client that, yes, I want to get to know you. But there was something about that that's like so many of our interventions are also just communicating to the unconscious. I think sometimes I can get stuck in like I'm asking for feelings and I'm looking for feelings. And I think reading through the German architect was like, oh, so much of what he's doing is actually just speaking and sending messages to the unconscious that I want to get to know you. I'm not going to be put off. It's just a good reminder for me.
Yeah, agreed. I feel the same way. Thanks, Tyler. But Justin, did I miss you? Did you have your hand up for a second there? And did I miss it, Justin?
Yeah, I was probably last.
Okay, do you want to go?
Yeah, just to kind of continuing on along the lines of Steve's question, I think a lot of people were reacting in a way that was sort of like, yeah, but the tone was probably, he's persistently caring. He's not being provocative. It's all in the tone. But which I understand and agree with. I think I just want to point out that I think Johannes, you're also kind of a staunch defendant of at times not using a very soft and caring tone. At times firming up your tone,
Yes.
and that is part of what we can do. And so just to highlight that the line between provocative and being very persistently caring is very murky. And there's often elements of both. And it is very weird to hold that because in some ways I feel like the model kind of balances on that. We all have a lot of experience knowing clients or people who use the model when it goes more provocative and how disastrous that can be. So the fact that that line is so blurry is kind of a scary thing to know that.
Ain't that the truth?
If you're not aware, if you're not really in tune with what you're doing, that you can take it in one direction and do great harm. While if you are aware of what you're doing, it seems like it can be very powerful. And I don't just to make a note that that line is very blurry, basically.
I really appreciate that. Ain't that the truth? Just generically, if we're going to move towards adopting a firmer tone, Davanloo talking down to the superego. The prerequisite for that is that the unconscious and or conscious alliance is sufficiently strong. If that's not the case, then you're going to blow someone out of the waters and have a misalliance, potentially re-traumatize them if you do that. So thank you for that reminder, Justin. Beautiful comment. Is that you, Kanwal?
Yeah, I just wanted to mention that when we talk about, Dr. Davanloo's tone would vary all along the session. His tone of voice would be very firm when he would be talking what he did with the German, and subsequently when after the breakthrough the patient is talking about the father, the tone would change like to being very nurturing, very caring, understanding. So the tone of voice was very different. And secondly, I think it's important that even if we get maybe too afraid of when we say provocation. I mean, first of all, as you rightly said, Johannes, that when you have the unconscious and conscious alliance going, and you are first of all able to notice that, and especially with your own countertransference, then only can you do this. And secondly, if you do make a mistake, and if you do we do know that repair, the benefit of repair, and so we can always go back and mention to the patient how was that when I was so, and that in itself. And the other thing was the connection part. People talk about connection. I mean, basically, we are helping the patient go to the bond between me and the patient, and obviously from the past and the current, right? So those are a couple of things. Thank you.
Yeah, thank you. Thank you. So given that we only have a few minutes left, is there anyone that hasn't said anything that would like to chime in? If so, I really welcome you. There's still some time left. I would love to hear from you if you feel the inspiration. Jamie.
Yeah, just a thought I had about the unlocking sort of part. I mean, when I was doing my training, especially in the earlier days, it was often communicated to us that a raised voice would be more sort of discharge rather than a genuine breakthrough of affect.
Right.
So I'm actually just quite struck by how wide Davanloo's repertoire of what what an unlocking actually looks like. Because I think for me it would have been, oh well, that's discharge, anxiety's too high, need to sort of regulate that. It's not genuine sort of affects. Whereas he saw something very, very different.
Right. That's right. I'm so glad you brought that up. Yeah, to me, the take-home point is that we can be too rigid in how we interpret discharge. Like I agree that obviously we want to have our fingers on the pulse around discharge and absolutely address explosive discharge if that's happening. But I think we can go too far in interpreting discharge because we're also looking at, is the patient sounding angry? Is the patient looking angry? And a certain oomph in the presentation is universal, is typically universal for anger. I mean, I know Scandinavians and whatnot have a more muted presentation than, say, Italians, so there's also that cultural factor. But thank you for that, Jamie. Thank you. Let's see, Anna. Anna? Oh, she's in the weight room. I thought she had her hand raised. Okay. We got a couple of minutes left. Anybody else either responding to what Jamie said or something else altogether before we say goodbye for today?
I would add something that also struck me is the emphasis that Davanloo also makes in the German Architect is even after the breakthroughs and after the therapeutic alliance is strong, he keeps reminding us that resistance doesn't disappear altogether. It will keep coming, and we'll need to continue address it. So we shouldn't expect, there's a breakthrough, we shouldn't have any resistance. But still, I think it's the important that for him, he still keeps the point that the resistance for him is like a compass. He knows that wherever there is still resistance, there's still more important things to go, and that's how it's important for that to be there as a guide to where else we need to go. So there's another thing I noticed.
Could not have said it better myself. Really well put, Yair. Thank you for that. We're at time. This has been a lot of fun for me. I hope you had a good time too. And just a reminder that these are voluntary meetings. You show up, great. If you don't, great, no problem. We're going to have these every 2 weeks or so, for the most part. If I ever only get 1 or 2 or 3 emails, I'll cancel it. But assuming that enough of you RSVP by sending me an email, we'll be doing this. Okay. So thank you for being here and sharing. I really appreciate it. We'll see you next time.